to the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we're in the other room and Mr.
I was honored.
All right. We have a chance to look at the minutes. So moved.
Second.
In favor?
Aye.
Has a resolution requiring, requesting the approval of the insurance recovery fund to be replaced for a totaled vehicle. And January 29th, or on January 29th, the health department was in accident and totaled one of our vehicles. $17,677 has been received from the insurance company, and health is requesting to use those funds to replace the total vehicle by entering into a 5-year lease agreement with Enterprise. By utilizing these funds, the estimate payment of $470 per month will decrease to $200 a month.
Want to get through this?
Who?
Second.
Any discussion?
Yeah, I just have a question. This was not a leased vehicle. This was a vehicle that the health department owned,
Correct, that's correct.
and it took from January till now to get this sorted. Okay.
That's what I was going to ask. Well, there's only like 4 of them.
Owned vehicle, we don't have very many.
Okay.
Is that
We
correct?
did
Yes,
that
we're
a while
trading
ago.
in most of them.
Yeah.
Yeah, this wasn't included with that.
That wasn't included. in
No,
the
because
figure.
this was an accident that happened in January, so we were waiting on their insurance.
Okay, that happened after that.
It seems like an ordinance about funds or something.
My understanding is that either the wrong department was let know that the insurance payment had come in, or it was just this that it came in. So
So
we
just
just
an
got,
administrative lap, nothing.
we just got word that it had come in.
Okay, thank you.
Is it a bad omen that it happened on my birthday?
Thanks.
Probably not.
You're not allowed to have any. All right, any other discussion? Motion?
We did.
We already did motion. Oh, yeah, okay. Favor?
Aye.
Opposed?
18.2 is a resolution requesting their approval to increase the preschool programs, other supplies, and expenses. We have received the most recent approved rate from the state for the CPSE. With costs per student continuing to rise and the increased number of students, we need an additional $7,175 to meet their requirement. Unused funds were found within the health budget to offset the increase, so there's no change to the local share.
Motion?
So, second.
Any discussion?
Yeah, I do.
Go ahead.
Where are these kids coming from? The population's dropping like a rock.
I got a video you can watch.
Now, was this exactly what it said?
Well, let's discuss it.
Significantly, one school district said.
It did say one school district.
There was one school district that had a significant increase in the number of children, which raised the cost of the CPSE costs.
Should we ask that? Can we discuss what this was? Can we mention the district, or is that something?
If it's in the resolution, it's public information, right?
One.
You said it was one.
Yeah, I don't think.
Yeah.
One school
I
district.
don't think it's in the
I don't think
resolution.
that's a good idea.
It's just in there.
Can I just ask a question too?
Yeah.
So we're mandated to pay this, so
Yes.
we don't really have a choice. This is just,
Right.
you're telling us that
This is what
money, we
did.
have to pay it.
Mhm.
Okay.
Yes.
Very good.
Any other discussion? I don't know as though that we should even identifying the issue.
It really doesn't matter.
It doesn't make any difference.
Well, it is, but you're
Richard asked.
money out.
Richard asked.
Just,
You know,
Where are they
why?
coming from?
That's the question, is why? Because I don't care if it's coming from the state, I don't care if it comes from, but we're still paying it.
Yeah, right.
You know, that's the bottom line. And we can't address a problem unless we know where the problem is and why.
That most of these are provider referrals that providers are seeing that these children need therapy services.
I'll just add that if we can get them therapy when they're younger, perhaps we can cut down some of the mental health issues when they get older.
Well, they had two parents, it's good start.
Well, we don't know that that's a fact.
Now,
We can't make assumptions.
we need to accept it on face value. Go ahead.
And we've had discussion before, Bill's mentioned this, about all we do is pay the bill. We have no input on the children that are selected, how they're selected,
That's correct.
and the rates that are sent, they're just sent to us. All we do is just
That's
sign and
correct.
pay the bill.
Yes.
We talked about having any sort of leverage on that being done to pass on to the school district. That's coming down at some point. I believe it'll probably not till next year.
There's definitely that talks.
This is taxation without representation.
Yeah, exactly. Just pay the bill.
any other discussion? All in favor?
Aye.
Opposed? Motion carried.
HE3 is a resolution requesting to accept the Healthy Families Child Welfare Protocol Award. Add 2 additional health program specialist positions. Our award has been increased by $251,154. With this new funding, the program will be able to serve an additional 14 families, bringing our totals up to 54 families in our county. Currently, we are above capacity at 108% with 25 families on a wait list. By accepting these funds, OCFS, which is the Office of Children and Family Services, requires that we have an additional 2 staff members. These positions will be 98% grant funded, leaving only 2% of the cost with the county, and that's for emergency preparedness drills and any required annual training that is needed.
And these positions will end when the grant ends.
Yes, we don't anticipate this grant at that, but yes. Okay.
I'll move it. Thank you. Do I have a second?
Yeah.
Any other discussion? Favor?
Aye.
Opposed?
Requesting the approval of the minutes from the professional advisory committee meeting that took place on June 12th, 2024. That's been included in your packet.
So moved. Second. Second. Any discussion? Interesting reading sometimes. Sometimes it's a little dry.
This one's a little dry, but all the information's there that we needed to put in.
But accept these?
Yes, please.
Yes, okay. So I need a motion to accept the minutes.
Yes.
Okay. Second. Second. If you have discussion, that's fine, but it's minutes. It's not something we can come back and change. Okay? All in favor?
Aye.
Opposed? Motion carries.
Thanks very much. Budget.
Budget.
No department updates?
I have a few. Do you want me to do a few of the
Want to do
department?
Department updates or?
You could do some updates. But this particular one, you're gonna, is that a pass?
Let me do the, yeah. So here are the numbers, and this is the overdoses information. The one that I provided for the committee.
This is from the state of New York.
But it's pretty graphic, and I had a discussion about it. I know they're a little hard to see. If you like this, I will make it bigger.
I want to read it, we'll make it bigger.
All the same information that I provided you. The one I provided you has a little more, real-time data, but you don't use OD map. But this is a quarterly information. It's really good. And all this information is public information that can be found on the state Department of Health website. Okay. So you're welcome. So it's the same information, it's just in the New York State format.
See, this is not, senior citizen friendly.
I can absolutely make it that way for you the next meeting.
I got 2020 and 2030. Tell you what.
I did-
I'm glad to read that document.
I did compare it with our data, and it is very close. Not significant enough to,
Looks like, from 22 to 23, everything's gone down. Ever so slightly, but it has gone down.
eh,
Always moving in the right direction.
always moving in the right direction.
Better than going the other.
Yes. So what we're doing is working.
So take note that the 24 is just.
Right.
Any questions, comments?
About the data. Then I didn't provide the environmental data, the one that I gave you. For strategic planning and accreditation, we are 75% completed with the documentation that needs to be submitted. Very excited that this is moving forward. The rest of the information should be approved by the PAC in the December meeting, so we should be, if not at 100%, ready to apply for accreditation. It will be soon after that point.
Good.
Strategic planning, our quarterly meetings continue to meet. Our staff is now entering data into our SharePoint management system, which is holding all the information for accreditation and our QI. We've started our planning phase for the next strategic planning for PAN to begin in the 25 timeframe. And we're getting participation from all levels of staff on how to move forward. Environmental, Oswego County permits one mass gathering every year, which is Super Dirt Week. This year, the event ran from October 6th to October 12th. The mass gathering inspections consist of checking for potable water, acquiring the number of toilets and hand washing stations that are needed, sewage disposal, camping areas, a large safety plan has to be submitted. Mobile and temporary food services vendors were also inspected. 15 total food vendors were present at this year's event. No critical violations were written. It went very smoothly. It was very well attended. Super Dirt Week began operations in 1972 and was operating in the Syracuse 45 years. They moved their operations to Oswego Speedway in 2016 and has been there ever since. So, very happy about that. We also had our last of the season rabies clinic that was held at the Oswego Town Highway Garage, October 16th. We vaccinated 114 dogs, 54 cats, for a total of 168 animals, and year-to-date totals were 1,451 vaccines given to our domestic pets.
Is that more than last year?
I think it's right around the same. I was gonna grab that number, and, yeah. I can send you an email if you'd like with that.
I had an opportunity to observe the town of Oswego rabies clinic, and I gotta tell you, what an outstanding job, folks. Really organized, very smooth. We gotta go back twice, the barn cats wouldn't cooperate.
Sorry I missed you. I was there. I filled syringes. early on, but like, yeah, good, I'm glad you
Yeah, I was
said.
really impressed with how smooth it was to get in and out, and how well organized.
Yeah.
It
Yes, thank you. Thank you. And that's what I got for update. Also, I did want to mention for our accreditation process, every once in a while, I do need to send out some good information. It's evidence-based information, maybe some research on different avenues or processes that we're looking at. So I thought maybe email was the best way to reach the committee. And we can, if I could send you an email every once in a while, just looking at different processes. If that would be all right.
It's not,
Okay, very good. Thank you.
I don't email people that. I don't know my name. I will not.
You can blow it up though on the computer so you can actually see it.
Well,
There's a little button on the bottom, you can enlarge the screen.
I don't think I'd be off the grid completely if I couldn't.
I have to have proof that I'm communicating with you. Not just verbally, but at written.
I do rent the dog out.
And that's really all I have for update.
Okay. So budget.
What page are we on?
Go ahead.
Look at it, I don't remember right page.
Eighty-two.
Yes.
Older book. I've done 83, do I have an older book?
Go to the front page and see what date is on Phil's. Well, if you go to 82, you should see preschool special education.
Oh, then I got the right.
Okay. Are we starting?
Yes.
Okay. I'm gonna turn it over to Jen, start with that.
We have a few items that did not make it into the draft budget that we need to add in. Vera's handing out a sheet. We had a couple items for the vehicles that we are selling to the DA's office. Those accounts were created in time to get added to the draft budget, so we just need to add that revenue in. So that is the first two sale of equipment lines on this form.
Thank you. Thank you. Very thanks.
Thank you. Haven't done ratio.
Everybody have one? Okay, so the DA's office is going to be making annual payments toward those vehicles. So those first two sale of equipment lines is the revenue for 2025. The third line is just the increase to the auto rental line to offset that revenue we're getting because the leases for those two vehicles are going to be a higher amount due to not having the down payment. And then the last one is Article 6 funding for our OD2A staff person. That is our person that works with opioids. They were previously funded under the opioid settlement funds, which there is not funding this year, so we're going to move that to an Article 6 funded position.
Did you pass out the other sheet yet?
Not yet. We started with these because these changes need to be added, so.
So I need a motion.
Motion.
Second. Discussion. Seeing none, all in favor? Opposed?
Oh, hold on. Who we voting on specific?
All we're doing is just adding this to our budget, right? We're not passing it.
Right.
We're voting on the whole
Just
budget or just this?
No, just this sheet. Good? Okay, pass.
Sure. So we were tasked with cutting the budget and removed many of the mandated items, and this was across all the stations in the health department. Some of these things were determined that we do not need them, and they were completely removed. Others, we would like your consideration to add back in or restore if possible. Jen's handing out the printout of the budget of items we would like all of you to look at for consideration.
First up, I need a motion. So moved. Second. And then to review, if you have a question. No, you can ask. If I understand this right, you're looking to add 75,000 to
That's up for your consideration,
No, that's
but I would, yes.
hang on to that thought for just a minute. So this is money we just put back in. The offset is, yeah, if you, I know the sheet says 75,000 at that bottom, but you just added 33,000 in revenue. So approving these, it's not a $75,000 increase net, what this committee does, it's 41. And we're still fine with the tax cap. So what? We'd still be fine with the tax cap. I don't care about the tax cap, I care about how much we're charging the taxpayers.
So the increase that we're looking for on this is about half instead of.
Yeah, between the previous motion and this one, it's an increase of 41,823.
Well, I certainly want the rabies clinics put back in, that's for sure. The other ones I don't want.
Well, we're mandated for 4 rabies,
Right, that's what's budgeted.
but we had 8 last year.
That's correct.
You want 8 next.
We like,
And this committee has already voiced that we would like to have.
but I cut from every department, so I had anything non-mandated that was cut.
Understand. So you want to go through this line by line? Take a moment to review it and voice opinion on any particular lines, and we'll go into the biggest total.
I think it would be helpful just to kind of cover the 2 big ticket items.
Okay.
The others are really insignificant,
I agree.
for their costs, and there's 2 positions there. So if you could just kind of provide rationale and justification for this.
Sure, so the LPN position, some of these positions have been vacant for over a year. This is one that has been vacant for over a year. I don't see us filling that position in the near future, but it is a nursing position. So if anything comes up at any time, we're gonna wanna be able to fill that position if we have to. It would not break my heart if you said, nope, we'll deal with it at the time. If another incident came up that we needed to fill this position, we'll take care of it then. That is fine with me. But it is a nursing position, and it's hard to give up a nursing position.
How long has it been on bill?
Oh, if not longer, over a year. I'm going to say over a year comfortably.
Do we get reimbursement from the state on this?
Yeah.
Yeah, it's on that column that says reimbursement.
Okay, that's
9,900.
9,000.
Have we seen, in that 1 year that we didn't have this nurse, have we seen an increase in return to infant health?
Yeah, we have 30 cases right now, which is unheard of for us. But we are doing it. We struggle, but we are definitely at capacity.
And one of the difficulties we have as government, underneath bigger government, is we can't pay nurses with hospitals.
Yeah.
We're kind of guided by, this is the maximum we can pay. That really contributed to why we no longer have hospices. Our reimbursement would not allow us flexibility to pay them more. If the state set the reimbursement, but the private industry doing that and set their own rates. They're allowed to do that.
We did just hire a registered nurse, and we had a full-time registered nurse that just retired, come back to assist. So I think we're getting it done, and we did hire a part-time already. We filled it in a full-time line, so we did just hire one.
Would you like to cover the second one? Because
Yeah, so the
two positions.
speech language pathologist, the honest answer is that I don't think we're ever going to be able to fill this position. It would have to be reclassed to a physical therapist or an occupational therapist if it was kept.
What's the need for one of those positions?
The need for one of those positions is that it does help us save money and it provides services to the children in our community. If they work with the wait list. The wait list, our wait list is usually extremely long for our children with special needs programs.
Would you say that the savings would exceed the cost of the position, or just a portion of it? I mean, how would you quantify that?
I would say the bigger issue is the ability to get more children off the wait list and provide services to those children.
I agree.
More so than
So less of a
And
financial
monetary.
part of
Yeah.
providing the service?
Yeah.
So when, Matt,
Yeah, go ahead.
so in here it says it will work with the special education teacher to complete evaluation and determine eligibility for services.
Mhm.
Who ultimately makes that decision? Is it the special ed teacher or would it be this individual?
They both do it together for the evaluations, which we haven't been able to do because we can't fill this position.
We would have some control, not control, but input on what services could be carried out. You-
Fill at least for the speech language and the
Right.
requirements and the,
And you don't think you're going to be able to fill it either, so just wanted to know for educate just the kids.
yes, if we decided to keep the speech language pathologist, I would be back here January, February requesting to reclass that position to a physical therapist or an occupational therapist, which I think we could fill.
Would they be certified?
I could definitely do that now.
You can
with the-
reclass it
right.
now. Is that a higher rate?
No,
Same
No.
day?
around the same page, if not a little.
Would that person be qualified to work in tandem with a special ed teacher to do the same thing?
For the evaluation, they could.
And you're fully reimbursed for that. 32,000.
No, it's 55,000, you get half.
Oh, I see, yeah, okay, sorry.
Richard?
Here, what, it says children, correct?
Yes, it is.
What age?
The intervention, 0-2,
I mean,
0-2.
I gotta read them out as a person. That's,
But that-
I think I look at it the other way, that if we're allowing children to go longer without services, I think it's going to be more detrimental in the long run than if we're able to take care of them early on.
yeah, but you can't get people,
No, but she's going to reclass so she can get something, so that it'll be a different title.
Right, because I have a wait list for speech language, I have a waiting list for physical therapy, waiting list for occupational therapy. I mean, we do have lists
So you're confident you'll be able to fill it right away.
for the PTO.
Yeah.
I would agree with that.
So that, yeah, I think it's a good comment. You guys think that's a good
Yeah, I
idea? We can
agree.
reclass it right now.
I agree with the fact that Kevin said, if you get them early enough, it's a lot easier to take care of them. Instead when they get older, and get older.
Is that right?
Absolutely.
Okay.
Then there'll be, if we don't fill it, it'll be back on the truck block.
Motion for that.
Say that out.
Oh, sorry.
Make a motion.
Yes, sir.
To a change speech language pathologist to,
So we change the position and add it back.
what title are we using to reclass?
I would say, I don't want to give my wrong. I don't want to give my wrong title. I would want to see what this is longer.
How much of a dollar difference are you talking?
That's pretty close to the same. They all make around, all the therapists make around the same. Like, let's see.
What's the argument to charge my phone?
There's just not,
Titles.
there's just not that,
Speech pathology is very difficult to prove.
The school districts haven't heard that.
They're having a hard time getting it to. I don't know why, but it is. It's just not.
The LPN position, what's the going rate for LPN?
39,000.
But I mean, is that the, what is it marked out in, for the hospital? For an LPN?
I would say in the 50s
For
for an
LPN?
LPN. Yeah, most hospitals, some have LPN, some don't. You see LPNs usually in the doctor's office or a clinic setting, and I would guess they would make probably in the 50s. We're public health. The nurses make less, they know, but because it's a different kind of nursing.
So, have an idea. If you leave it alone today, as is, you put it back in. Gives us time to check to see what the correct title is. And there are two future options to make that correction. Tomorrow at F&P, we have the information on it. They would just change it to the correct title. Or at your budget meeting in December, there's always 4 motions that are made. One of those is state any personnel lines that have changed since between tentative and adopted. We could add that in there as a title change to that list.
Doesn't sound that pertinent because it's the same, we're talking about the same like budgetary line,
Very,
right? So
very
it's just a
close.
title, right? So,
Like,
yeah,
like, make a little
I
more.
think,
yeah, I agree. Leave it for today.
But we do need to put it back in today at the same, what's here.
Right, you can either do these by individual motion, or if you're agreeable to the entire sheet, pass the whole sheet as a
Sold on the LPN. Did we have agreement on that?
I just, having, this being the first real look at the whole budget. I mean, this is the first time I've seen so many non-mandated positions removed from the department. Now, I understand, my concern is that the health department, you're taking out non-mandated positions, and other departments, you're leaving them in there. I think that, yes, keep this, we put this through. I'm really upset that we would even think about removing non-mandated positions out of the health department, because it may not be mandated, but I'll tell you what, Oswego Health, okay, we've come up a long ways since I started, 12 years ago, Rich, okay, where we were at the bottom, okay? We've come up a long ways. Here we are, we're going to take out, attempting to take out non-mandated positions. Okay, so that upsets me a little bit. But, so I'm in favor of it. The only thing I disagree with, a lot of things I've said to most of the committees that I'm on, it's the raises and it's people that you have working for you. Are they happy? Do you think that they're leaving and you can't get them because of, did a compensation study? You guys have heard this, 3 times probably now. And has that helped, or do you think that has not made any difference? I know you don't want to cross the bump. I know you know it's like, it's out of the bread your butter not. But, I'm in favor of this. I'm in favor of the whole budget. We can move on. Thank you very much. Okay.
I would just like to say I applaud that we move things at the request of the legislature so that we can see what we necessarily need to put back in, save cost savings, save our taxpayers money, and that we can relook at this. And I as he mentioned yesterday with the payroll study, there's more coming, right, for those people at the bottom of the scale. I think Phil's still trying to work on that. So there's another wave coming for those people, hopefully, that haven't quite made it to where they should be. So, fraction. So that isn't, it has been since things started. But again, kudos to you. I'm in favor of putting this back in as well.
Any other comments? So just you guys want to do this line by line, or you want to do it by the sheet?
Sure, it's a lot, whole thing.
We'll bundle it.
Your motion. Do it by the sheet. Or no, the motion would be to approve by custom changes. So, motion is to vote on the sheet.
That's the change. I agree.
Further discussion. No. All in favor?
Aye.
Opposed? Thank you.
Thank you all.
Thank you.
We have to approve the budget overall.
Here, can you get the correct title and page from HR and what Veronica would do?
Absolutely.
So you've had a chance to review the budget, I hope. I think that's next. So I need a motion to approve the budget. Second. As amended. We just amended it. Any discussion on the budget? Anything in the budget?
Page 83. Furniture budget, furniture, all that good stuff. Something, it's like,
Yes.
you know, Water Street's not done yet, but, I'm sure it's getting closer. Are you gonna need furniture there?
We have funding
You have
through the
for it?
infrastructure grant thing, all through
All
here
right,
that
so
we're
you
using
do have
for
the
what
money.
we need.
That was my question. I knew darn well you're gonna need something there. Okay.
Here's it's not grant. Check. What page you on, Richard? All right. What page are you on?
I'm looking for it.
Oh, okay.
Starts in
Here.
Department 4.
94, yep.
Okay.
Now, Director of Environmental, that's Hack, or whatever his name is.
Director is Caitlin Carter.
Okay, okay. 23, she was making, or was in the budget for 84, 762.
There was a retirement of a long-standing director.
All right, that's what I wanted to know, because it said this didn't make sense. All right. So,
Any other questions on the budget? Motion.
Can I just point out that I wanted to make sure that you guys
Sure can.
saw on the budget for, public health education and planning. Was that the one? No, where did we just put that?
Oh, that's healthy family, help, 4036.
Okay.
4036.
Okay.
So they just recently, you approved today in committee those two new positions. And in order to make sure that those positions were already accounted for in the 2025 budget, I did, if you look at the number for the salaries on 4036, which is on page 88, that number doesn't equate to the numbers under it. And the reason that I just added that in is I cannot add in salary, but I can just add into the salary line so that as you approve today, it would also already be represented in the 25 budget. So that's why it's higher. I just want to make sure you guys understood so that when I do actually fill in those two new positions, you aren't going, wait, that was 4, now it's 6.
That's fair.
Else? Okay, put the hammer down. All in favor?
All right.
Opposed? Passes.
Thank you. Thank you. Thank you.
Any other business? Guide's not there too. Need a motion?
No motion here.
Yep. Second?
Second.
Fair.
All right.
Thank you, gentlemen.